So, and Vaughn, you were saying that I think you usually talked about how people are showing up a little differently. Are you seeing that happen in Jackson, as particularly as you dealt with, for instance, the race after George Floyd's murder? And I know there were discussions in Jackson. Um, were you seeing, I mean, one of the themes that you both have talked about consistently, at least so far, is the vulnerability people are showing, their willingness to deal with anxieties and fears. What role did that play as you all move forward?
Well, it's unfortunate, but it's timely. Very few things I think have the power, the impact of a public health crisis to make people feel vulnerable. Most rooms that I walk into, I'm you know almost 6 feet. I won't go down. Almost 6 feet and 225 pounds. I'm muscular. To most people who know me, I look like I'm in really good shape. But to be vulnerable, I've got a CPAP machine and I have hypertension. So, those are comorbidities according to Dr. Fauci and the team. So I walk into spaces aware that under these unique circumstances, I'm as vulnerable or more vulnerable than a lot of people I know. And I think that creates, just in me personally, a drive to bring the best of myself to the table to help us navigate and move beyond the challenge.
Mm-hmm.
And I don't think I don't think I'm unique in that. Many of the people in our community approached it with the exact same insights.
Mm-hmm.
Um, at a systems level, we've had conversations for a long time about the expansion of healthcare access in the state, or the closure of hospitals in some of our rural communities. So generally, I think for our public, there was awareness that, listen, there are some gaps here.
Mm-hmm.
And we would waste a lot of time and probably lives if we ignored that. So I think kind of having been, uh, socially distant or quarantined, produced a rawness,
Yeah.
an openness to vulnerability, and just speaking more authentically.
Mm-hmm.
That I think allowed people to show up not in voice conversations alone, but in their social media posts and how they, poured their hearts out there, and certainly in our professional spaces, which can sometimes be all about your hard skills,
Right.
and the soft stuff is ignored.
Yeah, well, I want to pick up on this notion of space, because I think, as you both know well, and as you just said, Vaughn, it's the exception rather than the rule when we show up in normal times, vulnerable, willing to reveal our anxieties and deeper fears. That's happening now more and more. This is sort of a two-part question. One is, what's the nature of spaces that you've had to create or that you've seen created that enable people to step forward and show up differently? And moving forward, as this blur maybe continues or recedes, how are we going to maintain these spaces moving forward?
Wow, Beth, I'm happy to jump to that one first. I know it's not fun to get all the questions first, so I'll go. Um, we had an interesting experience at the Winter Institute as an organization. We're a really small staff of people. Um, when when the protest first began around the death of George Floyd, as an organization, we decided to host what in our work are called caucuses, where people of one racial identity get to kind of have an open forum. Well, it's a closed forum with other people who share that identity and express their thoughts and feelings. So we did that for a group of African American Mississippians, and actually a few people from outside of Mississippi joined. And we also did it for those who identify as white, or whose society identifies as white. Um, that's not something we normally do.
Mm.
There's lots of thought and scholarship even about the value in doing it, but we recognize that it would have value. I was not on the white call, right, for obvious reasons. But based on the feedback I got from my colleagues, it was a really robust conversation. And for many, it was cathartic. The call I participated in, it was the same.
Mhm.
And several of the common themes emerging out of both was this desire to not move beyond this moment alone, but for it to be a transformational moment. And that is a shared interest, shared value. That was one of the specific things that happened that I was involved in. But we saw faith leaders come together around the public health crisis and the systemic racism crisis in our community. Of course, getting to see our governor, who's newly elected as governor, with our state health leaders and emergency management leaders sitting at a table every day, having to take questions where many people in public have access to data
Mhm.
and be challenged to respond.
Mhm.
That was a new thing. So I'm going to count that as one of those spaces
Right.
that the Lord above created, that I
Right.
think has been encouraging for many in many ways, perhaps revealing in some others,
Yeah.
but beneficial to the community for sure.
It's interesting, Vaughn. One of a number of things I take from your comments on this is how intentional the Winter Institute, the William Winter Institute, was in creating these spaces. I think you said you had not created spaces like this before,
Mhm.
so this was something different. So you were willing not only to create space, but to try something different that met
Yes.
the time that we're